let's go ahead and get started, and we'll have a little bit before we get to the noon hour, and then we will have some more after the noon hour, and then we'll have a little bit of open discussion about public health. Let me tell y'all why this is in this class. This class seems to have several eclectic pieces to it, and it does. Your accreditation standards ask that you be familiar with public health, and I think that everybody feels like they're familiar with public health, but there are probably a lot more nuances to it and a lot more background that you need to appreciate, particularly as you're getting ready to move from this kind of a role in the classroom into a clinical practice setting. No matter where you go, no matter what you do, you are going to be responding and interacting with and having to address public health issues in your practice area. And there's a nice background to this. The slide set I am going to go over with you all was developed by the Centers for Disease Control, which is a big agency that we've all heard about and know about. But this is actually a pretty good presentation, and I got kind of a blessing. Ron told me this morning that he had looked at it when I posted it over the weekend, and that it was actually pretty comprehensive. If this would be considered very introductory so that you at least hear the terms and understand the methodology and maybe where stuff has come from over time. But any single topic that we talk about is a class by itself. I mean, almost as we go through this, each one of these would be a course in a public health degree. And of course, in the end, you have to always work on a project of some sort to demonstrate competencies, even if you solve the degree. And even if you're working in public health, it's always one project after another, because there are myriads of things that keep coming up. So let's go ahead and just kind of crank through some of this information. But maybe before I start, a little bit too soon, a little bit too quick. How many of you have worked with public health? I know that Ron was by training.
Sort of.
Tell me a little bit about how, Ashley, then I'll say you.
I have a MPH. I haven't actually used it though.
Okay. Yes, I know you were working on that MPH. Okay, so but you did get it, so you'll be familiar with all of this background and content coming forward. How have you worked?
Same. I have an MPH, but then I did a lot of research that involved interacting for public health issues.
Okay. Has anybody else worked in public health?
I work for the state for the tobacco initiative, so I have an MPH as well.
Okay, all right. How long did you do that?
About a year now.
Okay, all right. Do y'all read the paper? Y'all been seeing all the stuff at the State Health Department in Oklahoma? Okay. If that doesn't tell you anything, you'll understand that no matter what public health is, it's also a political arena, and that's true for healthcare. I mean, you can't say that delivering healthcare now isn't in a political arena, because when somebody's paying and the money is as big as it is, there's invasions everywhere. And there's quite a bit of overlap between any healthcare system and the public health sphere, which is big. Okay, so let's kind of get into this and take a peek at it. Okay, there are 6 big areas that we're going to look at in public health as an introduction to it. One is just what is it by definition, and some of the key terms, things that you see. Then we'll look a little bit about the history of public health. How did it come about? It's actually kind of interesting how it has come about. We'll look at the public health approach. How do practitioners within the public health arena deal with problems that come their way? Then we'll look at core functions and essential services of public health, stakeholder roles, and there are a wide variety of stakeholders in public health, and then determining and influencing the public's health. How does that happen? So it's a great grand arcing theme that deals with health of the population at large. Okay. Okay. You got some learning objectives here. Describe the purpose of public health, define key terms, which we'll look at, identify prominent events in the history of public health, recognize the core public health functions and services, describe the role of the stakeholders in the field, determinants of health, what are those? And a lot of these will be somewhat intuitive, but determinants of health, big issue these days, and then recognize how individual determinants of health affect population health. Okay, so here's some of it. CEA Winslow. You may know what CEA stands for. No, this is considered the father of public health, Charles Edward Anthony. When you see CEA, what do you first think of? Carcinoma embryonic antigen? Colon cancer? I don't know. Okay, what's else? But he provides us with a definition of public health. It is the science and art of preventing disease, so it's prevention, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. Well, that's just about everybody. So you can see, it doesn't only public health doesn't just address what patients and people will do, it also addresses what organizations and entities that are in larger and larger groups will do. And those larger groups can go all the way up to big governmental entities as well as the nation at large. Okay. What is the mission of public health? 2 are given here: Institute of Medicine, fulfilling society's interest in assuring conditions in which people can be healthy. Okay? Of course, we're all interested in being healthy, but the conditions that have to be in place for people to be healthy are pretty large. That gets into food, housing, safety, all of these issues, and every one of those, as soon as you get to it, food, clothing, housing, shelter, just the environment at large, that's the totality of living. And so it's a very broad set of interests that have to be met to do public health. And then the next one, World Health Organization, public health aims to provide maximum benefit for the largest number of people. Well, I mean, that's almost intuitive. We always try to do what we do to benefit the most people, but it becomes a large issue when you're looking at policy because we have limited resources. We know what we can do mostly in a lot of situations to make health better for people, but do we have the money to actually make health better for people? Then you get into choosing when you got a certain pot of money and a problem that costs this much to fix. You have to start deciding where we maximize, what can we focus on, what gives us the biggest bang for the buck to take care of people. And so public health is involved that way. Here are some of the big health terms that come up. Kind of distinguish it. Clinical care is what you're being taught to do right now. You're being taught to provide clinical care, to prevent, treat, and manage illness, and the preservation of mental and physical well-being through the services offered by medical and allied health professionals, also known as health care. So you're being trained to do health care, provide clinical care. You are health care providers. So that's what you do. One-by-one, individual patients are managed. Determinants are any factors that contribute to the generation of a trait. So we'll look at determinants in more detail, but it could be heredity, it could be birth location, country. It could be any of these things could be a determinant of health. You know, in America right now, it's not the same for everybody. So depending on who you are, where you are, and what access you have, you may have better health or not so good health. Because all those are big elements in deciding how people turn out. Epidemic or outbreak, you always think about these terms in regards to public health as well. Epidemic or outbreak is just an occurrence in a community or a region of cases of an illness or a specific health-related behavior. That could be a health-related behavior, could be smoking cigarettes, chewing tobacco. Oklahoma is one of the biggest states in the nation for oral tobacco use, chewing tobacco and snuff. And of course, we have pretty high rates of oral cancer as a result of that behavior within the population. Or it could be other health-related event that any of these illnesses, health behaviors, or health-related events in excess of what's normally expected. So when things go beyond the expected occurrence and they become large in number in incidence, then that's considered an epidemic or an outbreak. Both terms are used interchangeably, but there is kind of a nuance to it. Epidemic is generally perceived to be on a larger scale, like the nation could be an epidemic. An outbreak might be in several counties in Oklahoma. So in some ways there's that little bit of a nuance to it. So, but they both mean the same thing. More events are happening within a region, and the size of the region, by nuance, you might use epidemic for larger areas. And then health outcome is the result of a medical condition that directly affects the length or quality of a person's life. So we always talk about health outcomes. You got heart failure, you treat with these drugs, and you can improve the length and or quality of life. The issue that comes down here, and you will begin to feel it more acutely as a healthcare provider. Some of you have been healthcare providers in past life, and some have not. But in the end, it will come down to quality and how much does it cost to get that quality. This will be the thing that will drive you crazy as you go along, is knowing what you want for people and knowing what you think is possible for people, but also having the barrier of the cost to get it or the access to have those things. So you'll be part of the voice of the people who provide health care that will have to fight this battle about how much resources can we generate and use wisely to achieve quality. And of course, quality somewhat implies that you know what quality is. And quality varies even between patients. What you think is quality for somebody may not be what they think is quality or what they want. So it always comes back to that patient-centered approach as well. Given all of these things we can do and these outcomes are possible, what do you want to do? You know, you're going to have discussions with patients who may not want the same things you want. It's okay, okay? At one point that really bothered me, but it doesn't bother me anymore because I will educate, advise, and say here's what you possibly can achieve if you do these things, but if you choose not to do these things, here's what your path might look like, and I'll let people choose. Some people have told me in the past, well, we need to always do the very best for everybody all the time. Well, I am. I always would. But if the patient doesn't want that for themselves or refuses to access something or choose to use it, it's their life. You know, they can, I mean, it's like if you want to smoke cigarettes, you not smoke cigarettes. I know if you don't, you're probably going to be healthier in a lot of different ways. But if you choose to smoke cigarettes, then that's your choice. But be aware, here's your risk of these things is higher. So you'll have these discussions with patients, and you will have to learn how to be detached enough. Advocate for the good, but don't get emotionally involved in what they choose. You'll have to find the middle ground between pushing for help and advocating for it, as opposed to being emotionally affected by the choice they do choose to make. You'll see, as you get into the healthcare environment, how that plays out with a wide variety of personality types that'll come along. Okay. Okay. So just a small, easy one. Fill in the blank. Public health aims to provide what? Groups of people or individuals with the right to be healthy and live in conditions that support health. Got to be we're talking about larger groups of people when you're looking at public health. Look in that definition, there's one more word that you're also going to have to deal with, and you may already be dealing with this politically at some level. The right to be healthy and live in conditions. That's a big to-do right now in this nation and really around the world. Is health care a right? And if it is a right, how much is a right? Because there's limits, you know, to what's a right. And then if it's a right, if it's my right to have health care, what is my responsibility to the system that provides it? Okay, that's where it gets murky. Okay, I believe everybody has a right to health care. I don't think that, well, if you don't have resources, you just need to go over in this hole over here and just expire. But on the other hand, if the nation says we want to help you, and here's what we have to offer for help, then I don't think that you can sit over here and smoke cigarettes, drink, do drugs, carry guns, and shoot people. How does that fit? You know, somewhere, this is your right to health care, but when you have a right, what is your responsibility and your accountability within the larger system that does that? So I'm not trying to give you a political angle, but when people declare rights, they also have to own responsibilities and hold some accountabilities for things. And you see it kind of sliding that way right now. Here's how. In health insurance, there are plans now that if you don't smoke and can demonstrate you don't smoke, your premium might be a little bit different. But if you're a smoker and big time lifestyle kind of out of control, then it might be a little bit more. They're kind of making you pay for what you choose not to do. And of course that just creates all kinds of disharmony. It's not fair. Well, define fair, define right, define quality, define all of these things. So you're going to see it, and you're going to have your own attitudes and beliefs about it, and please do. But just realize you're going to be part of a dialogue where everybody's not on the same page about how these things need to work. But this is interesting. Public health aims to provide groups of people with the right to be healthy and live in conditions that support health. And I do believe that is, I believe that. Then how does that work, and what can you do? Okay. Here's another one. Well, a blank is the disease occurrence among a population that is in excess of what is expected for a given time and place. So what's that? That's C, epidemic or outbreak. Okay? Okay. History of public health. How did we get in this business of doing public health in the first place, such as we do it right now? This is actually kind of fun. I like this kind of stuff. I like to know why we do what we do. But the first one, you can see that there are 4 different lenses that we're going to look at that determine public health. And one of them is sanitation and environmental health. So that's one thing that public health deals with. But another way to look at the history of public health is through the history of pandemics. When disease have wiped out large populations, okay, that kind of was a stimulus to kind of create a public health awareness. Another lens we look at is disaster response and preparedness. When big bad things go on, public health action is part of that, and it's because you have these widespread disasters that we've had to think about how do we manage that as a society, a group of people. And then the other is prevention and policy. What does the nation do, or what does the governing unit do to prevent things? And policy is one way. So let's look at the first lens of sanitation and environmental health. Okay, it goes way back 500 BC. You got Greeks and Romans. They had these aqueducts, okay, that you see here, and this carries water, you know, positive, good fresh water from places that have good fresh water, but also takes sewage out, you know, of a city. So that's actually kind of forward thinking. That's a community sanitation measure. Okay, good for them. They thought about, because, you know, if you're in a place that stinks if you don't get rid of sewage within an area. Okay, so that it goes back quite a while that people recognized that environment and sanitation were important. 1840s, a public health act popped up in England, 1848, and they recognized that you needed to have some agency that oversaw how things went in a nation. Because in 1848, London was fairly large, it was into the millions of people, and that country is fairly packed in anyway, like most of the European nations, most of Europe. And what they did is they came up with a board, a group of folks, and then they gave responsibility for sanitation to individual boroughs or sections of the city, you know, like in London. So that's the beginning of control. It's hard to have health in a population of people unless some group takes control to say, what do you all need to do? Then they doled out money by the borough so people could run sanitation within their area. And of course the board can say what the sanitation needs to be done. You know, what does it need to look like? Okay, so that's one. Another sanitation, environmental health, Nixon put in place the EPA. Y'all have all grown up with the EPA being around for forever, but I actually remember when it was created. I was very young. I was 13, but I do remember it coming in, and I remember a lot of pushback because I was raised on a farm, and there are lots of pesticides and chemicals used on farms for fertilizer and for poisoning, and we actually had a cotton farm, so there was large spraying for bugs and boll weevils. And when the EPA came in, they started making rules about what farmers had to do. And my dad went ballistic because it was this invasion, you know, of folks in your area. But I will say this, he's no longer with us, but it turns out that the county where I grew up has one of the highest rates of cancer in the whole state of Alabama. And they have pretty much figured out that it has to be something that was in the water or the environment. And it's been localized back to a large amount of pesticides. This was back when DDT was around. I mean, you know these agents. Did y'all ever have to read a book in school? Because we had to read this book called Silent Spring. Y'all know that? Have you ever heard of that? There was a woman named Rachel Carson, and she wrote a book entitled Silent Spring, and I think it was written probably in the 60s, like 65, 66, 67, something like that. Somebody will Google it out. And it dealt with pesticides and what they were doing in the nation. And it was in Silent Spring was there are no birds. You don't hear bugs making sounds or crickets or birds. And I think the cover of that book at some point had dead bird, you know, like a dead bird. So they were saying that what we did to be economically advanced or efficient actually created problems in the environment. So Nixon eventually put in place the EPA, and now, being some of your residents of Oklahoma, some are not, what is the tussle in Oklahoma always about? What are we going to do to get oil and gas out, which is part of our economy, versus are we tearing up the environment and creating health issues for people, let alone earthquakes? So there's this issue in the world about just the environment, and are we doing bad things to it to economically benefit ourselves? And what's the balance between economy and making money and people having jobs versus damage, you know, long term? Of course, that's just debate. Okay, I'm not going to answer the question, but it's out there. But the EPA came along to safeguard air, water, and land in a wide number of ways. Okay, so that was sanitation and environmental health. That's one lens for public health history. Another is pandemics. These are the things where you have lots of people getting killed off. And pandemic is even bigger than an epidemic. When you think pan, y'all know what the root word pan means? Pan means everything. Like panorama, it's just the pictures all around. If you take, you know, pan the camera, it's panorama, so it's all, everything. It's like it's a Greek root word. You see it a lot. So pandemic is when it's all over everywhere. And there's been times in our history where this has happened. One, influenza 1918, 100 years ago. Look at that. 500 million people were infected. And of that 500 million that were infected, 20 to 50 million were dead. So that was like 5 to 10% of the infected people died. If that happened in the world today, right now, that would be shocking, you know, a shocking display, you know, a bad event. So that has happened. The most recent pandemic, do y'all know when that was? In terms of flu, 2009, okay, is the last big one that's noted. 214 countries, 19,000 confirmed deaths, okay? And every time about this year, we talk about flu shots, what are the strains, who needs to get it, who's high risk, what are the strains coming around from the world that we need to pay attention to. So not too many years ago, we had a big one. And I guess we're always worried about the big one, you know, the next big one. And there's movies about this to kind of prey on people's fear and psyche. But it wouldn't take, you know, it doesn't take a lot for things to mutate to become offensive to the world in a way that we can't really attack back. So I mean, we're fortunate, you know, we're the age and time we live in, but things could come about. So influenza has been part of what sparks public health initiatives, because when you have deaths that large around the world, no single country can fix it. I mean, you got to have World Health Organization, groups that can connect to each other to even solve a problem like that. Polio is another one that has happened, and this all happened in my lifetime. The vaccine came about in 1955. I was born in 1957. Everybody had to get the polio vaccine. Do y'all get the polio, I don't even think they do polio vaccine now, except it recurred not too long ago. Do y'all remember getting polio? Ron, do we do, I'm not a big vaccine person per se. We still get polio vaccine now. I think there was a phase where it didn't get offered to people because it was considered a disease that was eradicated. You know, in the 50s, we gave the vaccine and everybody got in, school-age children forever and forever, and it was believed to be an eradicated disease. Did y'all ever grow up knowing anybody who had polio as a child? See, y'all are mostly younger. When I grew up, there were people who had braces on their legs, and they would, you know, their issue was always what kind of pants to wear because you had these big metal rods on both sides to kind of strengthen legs, and it was not uncommon to see it because once you had the paralysis and the muscles were affected, it wasn't something that could always recover and come back. So people would be on crutches and have those braces on their legs. And then you didn't see it at all. I mean, you know, you just don't see it much. But it did kind of come back for a while. 1988, there was an outbreak in 125 countries, so I think part of the initiative is to come back with the polio vaccine. But I remember getting it. And I think, I'm just trying to remember right, I think they gave it to us as a sugar cube. Do y'all
Yeah.
remember that?
I just looked it up, and we all should have gotten it. And there's 4 of them. I have it on my shop records right here.
Okay.
It's oral.
Oral, it's oral, but I remember that we got that. Besides getting the TB test and all this stuff, they used to have a little device that kind of stapled your skin. It was a little ring with all kinds of little slits. Yeah, they don't do it anymore like that. But we used to be scared to death. They'd line us all up, you know, elementary school had to go into the gym and everybody had to go down the line. And they would do the vaccinations in the school. And it was like you had to line up. And I don't even remember back then if they actually asked your parents if you wanted to do it or not. Because you know now there's the vaccine phobes, people who are afraid that their child will get autism, you know, all this stuff that you heard about. I don't know that we were given a choice. I kind of felt like we had to go in there. I just don't think it was recognized that it was a risk. It was like a benefit. And we didn't think about stuff like that. But I remember getting the shots, the little staple deal on your skin that scared us all to death. And then we always thought the polio was pretty good because it was like a little candy. It was a little sugar cube that just melted your mouth real fast. Okay. Man, I hadn't thought about that in a long time. Gosh, I'm getting too old. Gosh. Okay. So we had the polio vaccine. And then another one is HIV. This is something that your generation has grown up with, and this is another one. I remember when AIDS was discovered. When I went to school, we didn't even talk about it. It wasn't even in the curriculum. Nobody talked about HIV. And then when I was in my residency, there were all these big CEs about it. We were trying to teach us about it because it was just then identified as this terrible thing. And pretty much back in the early 80s, if you got the diagnosis of HIV, AIDS, it was a death sentence. You were a goner. And there was no two ways about it. So it was pretty much uniformly fatal. And now it's not with treatment. So there's 34 million live with HIV worldwide, 20% decline in new infections since 2001. So it's gone down. But the bigger part is that the therapies actually sustain life for a long time. I remember when Magic Johnson was declared with AIDS in like 92 or 93, something like that. We were all shocked because it was this big public figure that we all knew. But he was placed on drugs, and at the time he started taking drugs, some of them were experimental, those reverse transcriptase inhibitors. They weren't even marketed for everybody. So it's like, okay, Magic's got all this money, so he's going to go get some drugs. And he did, and he pretty much is taking, you know, standard cocktails like they do now, and he's still here doing fine. Okay, so he's had it in control for, what, 30 years now? Yeah, he's getting close to 30 years doing that. And he had to be about 30-something years old when it was first diagnosed, so he's getting on down the road. Okay. Okay, let's look at preparedness for disaster response. This is another way that public health has come about. This stuff is all really interesting. Biologic warfare, plague used as a weapon of war during the siege of Kapa. This goes back to the 13 and 1400s, the Mongol hordes. Kaffa is a little bitty town on the Crimean Peninsula in the Black Sea back in that time. And the Mongols were after a group and they walled off in the city of Kaffa. And you know what they did? They flung bodies into the fortress city of people infected with the plague to run them out or to kill them off. So they catapulted dead bodies into the city. Isn't that gross? I mean, just to think about that. But they knew it was bad, and it kind of started off the first big wave of the Black Plague in Europe, across Europe area. So those were a pretty bad tactic to do that. But you know, people still think about it because what is the deal? Dirty bombs? You know, go in New York City with a bomb that is filled up with an infected agent of some sort and just throw it out. And you remember back after 9/11, everybody was scared to death of little envelopes with white powder in there. You know what they think that was? Say it. Anthrax. And so everybody, anytime you saw something that didn't look right, it's like, oh, you know, what is that? So terrorists and evil people will always think about ways to kill you, and subtle ways to kill is to introduce an infectious agent into the water supply or into the air, you know, somehow to do that. So it's nothing new. We just have different ways to make it come about, you know, to kill a lot of people. And besides, you're scared to death if you think something like that's coming, because they're like unseen bombs, you know, unseen invaders that would get you. Another area, September 2000, 9/11, public health was very big after those attacks in both New York and Washington, because they weren't sure what all was what was part of the attack. You know, were there things inside the planes? Were there chemicals that were coming out? And there were also concerns about when you burn up buildings that big with all the materials within them, what chemicals are now in the atmosphere, and was there sickness that was coming out of that that we didn't know about? Another one that's not on this slide, I remember, and this is true when I worked in the VA, Agent Orange. Y'all know the term Agent Orange? Vietnam veterans have there's just a whole Agent Orange program in the VA. In Vietnam, one of the things that America did was spray defoliants into the jungle, because the Viet Cong would hide out in these just dense jungles. You couldn't see anything, so they spray Agent Orange to kind of kill everything off, and then you can see better and kind of kill off their natural hiding places. But Agent Orange was breathed in by people and walked through, you know, by people, and it created a whole number of adverse events, you know, in those folks. So if you can prove you were in Vietnam and you're exposed to Agent Orange, then you got great benefits in the VA system. And there was a program coordinator for Agent Orange, and this is the Vietnam era people. And it's no different now in Desert Storm. They were afraid that, you know, people have diseases coming out of the desert because people had behavioral changes and vague constitutional symptoms, don't feel right, lightheaded, dizzy, weak, GI complaints of some sort, and they didn't know if there weren't infectious agents in the desert sand that were foreign to our systems. You know, American people go there, would they get sick from that? So I think they're still trying to figure out what all might be involved in these invasions and things that we do, you know, to fight battles, fight wars. So there's one, but public health workers were very important after 9/11, trying to surveil areas, take cases, follow the types of illnesses that might pop up out of that to see if there was more involved in the attack or what the consequences of the attack were. And then Hurricane Katrina, this will all be in your lifetime. Another area where there was public health workers spent a lot of time in this natural disaster trying to figure out if they did surveillance for illness and injury in shelters and evacuation. But you know, when you have big things like Hurricane Katrina, where water piles up in places it's not supposed to stay, and then it becomes stagnant in places it's not supposed to stay, and it soaks materials, building materials in water that then kind of rot down, what does that do to air, water, and the environment? Yeah, so there's that big piece. Okay, so that's another lens. So we've had the lens of sanitation and environmental health. We had the lens of pandemics, which public health is involved with. Preparedness for disaster response, which I think makes sense. And then the final thing is prevention through policy. Okay. This is when governments put policies in place to benefit health on a more global level, societal level. And it's interesting, Book of Leviticus, who has read it or who can admit that they've actually read it? It's a hard book to read. Okay, I've been through Leviticus one time. That's enough. Because it's just very repetitive, but if you look at it, what does it get into? Even for that time, this is like 1500 BC is what we're talking about. It was about sexual mores. Do you have sex with people, and what does that look like? Because that can spread, sexually transmitted diseases. So that's part of it. Another had to do with foods, how foods were cooked, which things to eat and which things not to eat. And when you go back and look at it, some of the things that were being avoided were things that, if not prepared right, or depending on where they came from and how long they were stored, like seafood, there's things against shellfish and things, that could be infected depending on where they were harvested and how they were prepared. There were things about public exposure to skin diseases, like lepers were held out, and if you had oozing, draining sores on skin, how you had to prepare that and stay away from people. There were, claims against women. When menses happened, that was considered unclean, so they were segregated. Things we know more about now, but back then they were all efforts at public health for a community of the nation of the. Wasn't the nation of Israel then, but it was the tribes that would eventually become the nation of Israel. So that's the first one that's come out. Another area, tobacco. So that's public policy. Tobacco laws banning smoking in public places so that secondhand smoke doesn't come to you, but also kind of secondarily to discourage people from smoking in the first place. Any hospital now, I don't know any hospital that allows smoking roaming around. There's little rooms outside, little places you can kind of park, kind of like at airports now, there's little spaces to go to do that. And smoking is down, because of those things, but that was to protect people. And I remember when it first came out, hullabaloo. Were any of y'all alive at that point? I mean, to remember it? Kinda, maybe. It was a big deal. People thought it was trampling on rights. If I almost smoke, I can smoke. And that was a whole deal. Well, can you smoke if I know that your smoke hurts me? Now, your right to smoke, okay, you can smoke if you want to. Nobody's going to pull that off of you. But you can't smoke around me because now you're getting up on my rights. So it was not just easily done. It was a real pushback. And you'll see in your generation, there's all kinds of things that people are looking at doing. This whole thing about weight, activity, drug use and these things, you haven't heard the end of it. As it costs more and more, there will be pushback from the people paying more and more, or being taxed more, or being regulated more, to push back against that. So there will always be this tug of war between those who manage and pay and those who do and claim a right. So you'll have to get in the zone and kind of dodge all these things as they fly at you, but it'll be out there. And there will be more things discovered that we don't even know about. Okay, snooze. Pick a time. How about go away? Remind me in 3 days. Thank you. Get out of here. Okay. Okay, so the tobacco laws. And then another one, obesity. Huge issue now. More than 1/3 of people in America are obese by definition. Y'all heard this. I know Dr. Latassi talked about it, but it comes up in almost every disease you talk about, from joint, musculoskeletal, to cardiovascular, to endocrinological, to you name it. Being overweight is not a healthy condition that we know about. So now what do you see? Food labeling. I remember when they first showed up with food labels, there used to be no food labels other than what it is and how good it is. And now there's all this regulation about how much to eat, what's contained in it, which is helpful. There are ads promoting physical activity. Gosh, just all kinds of public service messages. Well, those come from public health efforts out into the world to help us change our behaviors to an extent. One of the big ones that happened were fairly recently, got all kinds of pushback. Y'all remember when New York City tried to get rid of soft drinks and machines, and they tried to cut it back to anything greater than 16 ounces was kind of disavowed in the city of New York. And this was kind of Michelle Obama's push, on food in schools. Well, it always goes the same direction. I think those are very well-placed intentions, but again, it's the right. I can eat what I want. I don't like your food. I can drink what I want. Shoot, if 16 ounces, greater than 16 ounces is banned, what stops me from buying 2 whatevers or 3 whatevers to get my over 16 ounces? So it eventually didn't go anywhere, and it was a ruckus. Y'all remember on the news all the ruckus that went on in New York City about people getting in my business? Oh, it's just all over. And all the pushback, like, they're going to try to tell us how to eat now and what we can drink, and it just really carried on. I think it was effective at the level of making people aware, but it's not going to be effective if culturally foods and drinks are what are part of what makes you feel part of a community. That's a much harder thing to change because it changes the culture of the group. Okay? So when you speak health to somebody, they will hear it through the lens of their culture. Okay, you talk about obesity. There are ethnic groups where being obese is considered beautiful. And being skinny is not beautiful. And I've talked to patients about this, and I'll say, tell me about it, tell me why. So they'll tell you all these reasons why. And you'll say, well, this is what your weight would be. And they'll just tell you, well, I would be a skeleton, I'd be dead. Nobody would look at me. No man wants to marry somebody who's that skinny. And I'll say, well, what about these models in the magazine covers? They don't care if it's not their look. They wouldn't look at it. They would think that buxom, big hips, big thighs, that's attractive. So I'm just telling you, when you start talking about what's healthy and what's out there, be prepared to get a lot of pushback from people who don't view the world that way. Okay? I'm just saying. Okay. Which of the following events in public health history have been pandemics? Okay, is Siege of Kaffa a pandemic? No, it's dead bodies on the Black Sea. No. Okay, influenza? Yep. Polio? Yep. Hurricane Katrina? No. It was pretty bad though. I wouldn't throw it down the tubes, but it doesn't hit pandemic because it was America. It wasn't multiple countries. Pandemics are usually international. I think they may be international by definition. I got to cross lots of borders. Okay. Public health approach. We'll get this one done and we'll let y'all get out of here to eat, refresh, and then we'll flow on through the rest of it. Okay. Public health approach. You can see here there are a number of steps when public health deals with problems. And the problems that public health deals with are diverse from what we've talked about already. Infectious diseases, okay, the flu virus, chronic diseases, hypertension, diabetes, those are chronic diseases and they are definitely a public health threat. Emergencies, injuries, okay, not wearing seat belts, that type of thing. Environmental health problems as well as other health threats. A process is usually used by public health people when they do it. First one is defining what is the problem, so that's where surveillance comes in. This is a class all by itself, surveillance methodology and techniques. But public health will evaluate what is the problem by doing surveillance. That's part of it. Risk factor identification is another. What is the cause? Are there elements in the society? Are there behaviors in the society? Are there methods of transportation or movement of foods that are problems? All of those things could be looked at as risk factors. So risk factors can be not only elements of a human body, but it can also be elements in the society or how things are wired together. Okay, so that there's risk factor identification. Intervention evaluation, what works, what has worked in the past, what can you do, and then finally implementation, how do you do it? In the implementation stage, there's lots of ways to get things done, but which things work the best? And always on implementation, you do implement a public health initiative within resources. Okay, we can think of a lot of good things to do, but you may not be able to think of where to get the money to do the good things you can think about. So you're always doing implementation within resources, which is where politics pops up again. Okay, so we've done the surveillance, risk factor identification, intervention, then implementation. What are the public health core sciences? Okay, there are quite a few. There are 5 that are listed here. See, public health at the center, but 1, 2, 3, 4, 5 work together. Let's start with epidemiology. Epidemiology, there are epidemiologists. I've worked with epidemiologists. It's a fascinating area to look at. And epidemiology deals with how diseases originate, where they've come from, how or why they move through populations, and how we can prevent them. So epidemiology is not just where something comes from, but how it has moved to become the condition that we see, on the ground. So that's epidemiology. Laboratory, public health laboratories perform tests to confirm diagnoses, but also sometimes when something is popping up in a population, we may not know what's caused it, so they may be doing analytical research into water, food, air, what's out there that might be linked to we know that this is happening in, let's say a lung disorder is popping up in a large number beyond expected norms. What is it? What they're drinking, what they're eating, what's in the air, houses they're in, who knows? So you explore what originates disease and how is it spread within that population. That's what epidemiologists do. And then the public health actually does the laboratory work to analyze things to see if they can find links to what's going on. Informatics, another area, huge. Have any of y'all ever taken an informatics class? Okay, you've had informatics. Has anybody else done informatics? Have y'all heard healthcare informatics? Health informatics? Huge area. Oh man, it's big. It will get bigger in your lifetime. We finally now have databases and computer systems powerful enough to hold and manage information. And the more computerized healthcare gets, and it's pretty computerized now, it's just that they're not all connected. Okay, EMR in this clinic doesn't necessarily communicate with EMR in this clinic or hospital, but that's one of the agenda items that was part of the Affordable Care Act, was to go to electronic and maybe to connect everything. Well, it would be great if everybody who had X diagnosis could have all their data collected somewhere in the world, and then you could kind of pool it and start seeing what interventions made a difference and how you deal with that. So health informatics deals with databases, computerized databases, and how to manipulate and mine that information for useful knowledge about disease and prevention and effectiveness for cures and things. I'll tell you, in pharmacy, I know we had a huge department. They ran with state Medicaid data. They had every medication filled was in the same computer system, so they knew diagnoses, therapies, doses, durations, compliance rates, combos of other things, and they would just mine this information and ask questions about what are we seeing in our population. If we use drug A at this dose in this group, how does that turn out? And is it worth the money spent? And you get a positive outcome. So health informatics does that type of a thing. Collects the data, analyzes the data, offers analyses and potential solutions. It's good. It's actually pretty interesting. It's beyond me, I'm too old for it, but I think it's good for people who like that. Surveillance, we've already talked about. Surveillance is just monitoring public health situations. A lot of different methodologies that can be used there. And then prevention effectiveness provides economic information about decisions that are made. If we decide to put TV ads up everywhere about obesity, or, about what food to eat or not eat, and we advertise, is that money well spent? Does it change anything? So it gets into intervention and outcome and decides if it's a good use of money, or cost-benefit ratios can be calculated doing that. So that's part of prevention effectiveness. Helps people make decisions long-term and maybe compare options. If we do this, or we do this, or we do that, which one is the best spent money towards the end that we're looking for? Okay. Now, the one thing that has to be said about this is that no science alone, no one of these sciences alone, prevention, effectiveness, epidemiology, lab, informatics, or surveillance, is the whole of public health. They really work together, and I think you can see that from surveilling to figure out what's going on, to epidemiology, where things originate and how they move, to lab exploration and informatic information and surveillance. All of those things work together to create the public health network and how it functions in the world. Okay, let's just take a break. It's 5 after 12. Get out. Come back if you want and we'll finish up the other part of this.
Excellent. I was kind of
I don't have the slides.